We're going to record this for the people who aren't able to make it to the very first book study session for book one, or I
Great.
should say for volume one. Yay. So, do I
Yay.
have permission from everybody to record you? Go ahead and just raise your hand if it's okay.
Good.
Hey, everybody's okay. Great. I'd like us to take a moment to introduce ourselves real quick, and then we'll mute ourselves unless we're speaking. Sherry, I'm going to let you introduce yourself, honey, and then you can mute yourself while you finish cooking your dinner.
Okay, my name is Sherry Turner. Anna and I have been friends for over 20 years, I believe. And I got involved and was able to meet Anna because I unfortunately lost my firstborn son. He had hypoplastic left heart syndrome. And I have been a scriptwriter for Breathe But Still Me when it was called Heart to Heart with Michael. I have helped, I believe, on Heart to Heart with Anna, and I have been a guest a couple of times. I am really looking forward to the book study and hope to work more with Anna in the coming year.
Yeah, and what really excites me is that Sherry is going to help me with the revision of the 25th anniversary edition of The Heart of a Mother. So I'm super excited to be working with her. She's been a beta reader for other books. She even missed a plane as a beta reader for The Heart of a Father.
Yeah.
I heard that story.
Yeah.
It's awesome. So thank you so much for being here tonight, Sherry.
Oh, no problem. And please don't think I'm rude if I bop around to work on my family's dinner. I'm not a good planner and I didn't plan well enough for the time frame and they still need to eat. So,
Everybody needs to eat, not a problem. I'm just going to mute your mic, sweetie, or let you mute your mic, and then you can unmute when you want to talk to us.
All right, hold on. I'll mute it.
Okay. Megan, would you go ahead and introduce yourself next, sweetie?
Sure. So my name's Megan Tones. I got involved with Heart to Heart with Anna, I think about 8 or 9 years ago. It was 2015. I was a guest on the show and I started helping out as a script writer. Obviously, the reason that I was a guest on the show was that I have a congenital heart defect. So I was born in 1983 with a large VSD, and over the years, a few other things went wrong as well. So they started with the pulmonary artery banding when I was 4 months old because they were not quite sure what was wrong with me, whether it was a really large VSD or whether it was a single ventricle and they should do the Fontan. But when I was 5, they went ahead and put a VSD patch in, which worked pretty well, but I was having some issues with arrhythmias and heart failure and ended up with a right ventricular outflow tract reconstruction when I was 10. I still don't really understand what that is, but I guess it's something to do with the pulmonary valve and a mitral valve repair when I was 25 and an ablation when I was 29, and that's been it for procedures for me. Hopefully, I won't need any more. I just turned 41 the other day and feel pretty good. I think in large part due to all of the newer heart failure meds that are around these days that didn't exist back when I was younger. And I helped Anna with the Heart of a Heart Warrior book with the co-editing and working with all of the co-authors, and it's been such a great experience. We've had people interested in doing another one, so I'd say that will probably happen at some point.
Oh, yes, it will definitely happen. We've already started receiving essays, which is really exciting. Megan has been a joy to work with. Not only did she co edit, but she wrote 4 of the contributions, and we'll be hearing about those very shortly, definitely during the course of this book study. So thank you so much, Miss Megan. We have my dear friend Eileen. Do you want to introduce yourself to us, Eileen?
Sure. I'm Eileen Perlman, and I am the mom of a 40-year-old. She'll be 41 in a few months. So, like Megan, she was born in '83. She had hypoplastic left heart syndrome with double outlet right ventricle, and which saved her. She had 2 holes in her heart and mitral atresia, so she was pretty complex, and she had her first surgery at 4 days old. Then she had that was pulmonary banding. Then she had the Glenn procedure at 18 months, the Fontan at 5, a revised Fontan at 12, and a heart transplant at 16. In the past 2 years, they've found that after 24 years with her, or 20, it was 22 years with her heart, she was developing coronary artery disease. They've placed about 5 or 6 stents. I've lost count because I don't get to go and do everything with her anymore now that she's older. Plus, my daughter Amy goes with her a lot. So she had a kidney transplant 9 years after the heart. She will need another heart. So I try not to think too much about it, but it's the reality. And like Jason said, heart transplant is not a cure.
Exactly. And what's also exciting is that Jessica let us put 2 excerpts from her book, The Hearts of a Girl, in our book. So I'm really excited about that. Now, that won't be in book 1. That's actually in volume 3, if I'm not mistaken. So,
That's
you'll
what
have
you told me
yeah,
earlier.
yeah,
Yeah.
you'll have to keep coming back, I think. Okay, next is my better half, Frank Jaworski. Do you want to introduce yourself, love?
Happy to. I strongly dispute the better half. I find myself working
As you should. You're a good man.
try to stay caught up with my wife. It's not easy. She's way ahead of me most of the time. My name is Frank Jaworski, and I am in the heart community because my youngest child, my daughter Hope, is a hypoplastic left heart syndrome patient. Originally, that was the diagnosis. Now she's on a single ventricle. She has had 3 open heart surgeries at the ages of 8 weeks, and that was 8 months, son, or 9 months, then at 17 years. And she is doing well. She works as a pharmacy tech here in Texas. And as far as I know, she's doing great. But like with you, Eileen, we don't get to follow all the medical stuff because they don't want us to know anymore. Doing the best we can. Personally, I've been married to Anna for a long time, 38 years almost. And I work as a nurse anesthetist in Texas. I administer anesthesia for surgery and procedures. And I do a lot of work with electrophysiology and ablations. So
Yes, and he's my go-to man when I have questions about any electrophysiology stuff. And him and I'm really lucky I have a couple of doctors that are really awesome at answering questions for me. So thanks for being here tonight, Frank. Jason, I asked Frank to come so you wouldn't be the only guy. So
Oh, thank you.
so we'll let you introduce yourself next, sweetie.
All right. Yeah, I'm never offended to be the only guy, by the way. But I am Jason Crutchley. I was a former CHDer, atrial septal defect, transposition of the great vessels, subaortic stenosis, pulmonary atresia, and trilogy of flow. I had a heart and liver transplant 5 years ago, cancer survivor, stroke survivor, and I'm a contributor author in the book, The Heart of a Heart Warrior.
Awesome. I tried to twist his arm into being the narrator for the audiobook, but I wasn't successful. So you have to hear a Texan and an Aussie do it.
Yeah,
If you're listening
unfortunately.
to Heart with Anna, I'm excited to
You're
put
going
it
to do
out
fine.
there.
Don't worry.
We'll see how it works out. I might come begging you to help me out again later, though. We'll see. Did everybody get a chance to read chapter 1 or listen to it on Heart to Heart with Anna?
Yes.
Yes,
Yep.
pretty much? Okay,
Yeah,
great.
we read it, didn't we, Anna?
Oh, honey, we've read it. We've slept with it. We've slept on it.
I've actually been able to listen to the first part of what you did, about why you did the book and that kind of thing. I couldn't find where you had this chapter 1.
Okay,
So
so
I'll get to that from the
in that
email that you sent
email,
us
I
out.
sent you the links. And so if you listen to the first part, that was 2 weeks ago. And last week's Heart to Heart with Anna episode has chapter 1.
Okay.
And the
Okay.
episode that comes out tomorrow will have chapter 2 and the first 2 essays of chapter 3, because that's what we'll go over next week. I didn't feel like we needed a session to go over the preface and the intro, but if you all want to talk about it, I'm so excited to have the foreword by Dr. Corinne Smora, who was also born with a congenital heart defect. And Megan can weigh in here. She was completely delightful to work with, and it was so nice to have a social worker who could talk about the importance of the book that we did and why we need a book like this, because there just isn't
Mm.
really anything else out there like it.
No, it's very unique because we have essays from lots of different people. I'm sure lots of us have read individual books by people, and they're very engaging too, but they're just one person's story. And I think this one is unique in that respect. We have about 40 contributors, I think, in the
Mhm.
book. So it's quite a lot.
Yeah, 40 contributors, 48 essays or works of art. So I'm going to ask one question from each of the different essays, and then I would love to hear any of your stories that deal with the topic of growing up with a congenital heart defect. Or, of course, for us parents, it's not about us growing up, but it could be about us watching our children grow up. So, in A Soul Unbroken by Jenny Busta, she shared an experience that she had with bullying, and I'm wondering how you have handled bullying in the past, and anybody who would like to talk about what they thought about Jenny's essay. And I guess the easiest way to do this would be on the bottom, there's reactions, and you can raise your hand. And then that way we won't have more than one person speaking at the same time. Okay, Jason.
So Jenny and I actually spoke quite a lot about her bullying. In fact, I was very impressed. Jenny actually lives in the same city as my grandmother. In fact, right down the road from my grandmother, ironically. And we've gotten a chance to meet and we've gone over a lot of that. And I was very amazed to hear about the bullying that she actually went through. And then, of course, to reread it years later in this book, I was like, wow, that's right. I recalled like minor bullying, but I think it was more just typical kid bullying kind of thing, not so much pertaining directly to my heart condition, with the exception. I do remember growing up and the kids are always like, "Oh, you've got purple lips. This boy has purple lips." And they would give me a hard time with that. But my brother would step in and would tell them really what needs to go on, that they need to stop. And then after my brother had passed, of course, I didn't have that safeguard, if you will, but I never really dealt with a whole lot I did have some, but not to the extent that Jenny went through it. Hers really was just amazing for me to just, again, hear about in person from her, and also to reread and just reaffirm that. I was like, wow, I guess this really does happen. I grew up in a small town, so I think maybe that makes a difference. Everybody knew everybody, but yeah, I dealt with some bullying, but not much, not like her.
What did you think about the end of her essay where she talked about hoping that the bullying would be over once she was an adult, but how now people put expectations on her that she doesn't
Yeah.
feel are realistic considering the severity of her heart condition? Have you had that kind of, maybe not bullying, but maybe prejudice or what?
Certainly the expectations. Yeah. I walk around generally and I look extremely healthy. And even prior to transplant, I did a lot of stuff that a lot of times most people couldn't keep up with or couldn't do. For example, like hiking. I'd go out for a hike and sure, I'd go flying past everyone. But then I'd be sitting there at the top, just catching my breath, like dying. And I think for me, there was that expectation that I have to do better than the other people, simply because of my condition. But also, I don't want to slow anyone down because of my condition. And so the opposite of part of that is, of course, them going, oh, he can do anything now. And there were times when I really couldn't, and they wouldn't understand that. Yeah, I still get that a lot. In fact, just the other day, I was painting at my work and I'd come home every night just beat exhausted. And we're just talking about painting, which is in itself can be very challenging. Everything involved with it, the taping off and then the painting and the bending and the stooping. And by the end of the day, I'm exhausted. Whereas I could go and chop wood all day long and I wouldn't be nowhere near as exhausted. So it's really strange what does affect me and what doesn't affect me. And then how do you handle that? Because, oh, you were able to do this. How come you can't do this? And it's, look, get in my shoes and try it out and then come and talk to me. So yeah, there is still that expectation that you should be able to do a lot better. And there's some days I can, and then there's some days that no, it's not going to happen. I've had to learn how to set my own limits and go with that and be comfortable with saying, yeah, I'm not going to do that because of my own limits. I'm saying no. And as I've gotten older, it's become a little bit easier for me to do that just because everybody has that ability to do that. And what's right for you may not be right for me or vice versa. So I don't know what you're going through, but this is what I'm going through. And I know that I can't do that or I can do that. And you may not be able to, and that's okay.
Great. That's a great answer. Thank you so much for sharing that,
Yeah,
Jason.
you're welcome. Mhm.
Megan?
Yeah, I think I've had some similar experiences to Jason. I'll apologize in advance if I have to get up and run and get my dog because she gets stuck in the dog door and just stands there and barks. So if she does that, I'll just run and grab her. But yeah, when I was reading through Jenny's essay, I thought, wow, these kids are awful. And I couldn't believe the amount of bullying she experienced either. She certainly wasn't a physical threat to the other kids. It was just really cruel. And I think especially after her mother had also gone and tried to educate the children at the school about what she went through. It's just really sad how these other kids seem to lack empathy for her. And with my heart condition, that certainly wasn't the case at all. The other kids were generally fairly kind about that. I remember some of them came to visit me after school after my operation. And admittedly, the teacher probably drove a lot of their stuff, but they sent a gift for me in hospital with cards from all the kids. And I've still got all that. It was a really just a treasured memory for me. And even at high school, the kids weren't rude about my scar or anything like that. If anything, I did occasionally get a bit of bullying more so because I was a bit weird. Like I was actually diagnosed with autism at 40, so I was a bit socially awkward and unusual, but not so much so that it attracted the attention of any of the teachers or anything like that. But I think the occasional bullying incidents were largely due to that rather than anything to do with my heart condition or my appearance. The other kids seemed to understand that there were things that I struggled with. And there's my dog. Sorry.
No
I'll
problem.
just grab
Thanks.
her.
Thank you for sharing that, Megan. And I really
I,
appreciate that. We'll be talking about your essay here in a moment. Eileen, did you want to share something?
Jessica wasn't really bullied very much at school. She always hated being the smallest one, but nobody ever said anything. The only time, and I think I told you about this today, that I can remember her being bullied was in PE when some of the kids saw her scars and they started questioning and making comments. And one of her friends told them that she has a heart problem and that they need to back off. And I never heard anything else that bothered her. She did miss a lot of school growing up, especially in high school when she was really failing health wise. That was hard for her, but she's more than made up for it. She went to college, got a master's degree. She has never wanted to call a lot of attention to her heart issues. And for me, it was therapeutic talking about it. So she's like, why do you always have to talk about it? And I'm like, because I feel that's our life. And that was therapeutic for me. So I guess I might handle it differently with what I know now. But I'm a speech pathologist and I have been in the field of special ed for years and years. And we deal with bullying all the time. And even the special ed kids can be bullies. They're not completely innocent, but we do see a lot of kids and adults that have been through bullying. And I was telling Anna earlier today that it really has a lasting effect. I mean, it affects them at the time of being bullied. It affects them when they go home because they're worried about the bullies. And then years later, they talk about it and they're just like in tears talking about remembering how they were bullied. So it is a huge problem.
It
So,
is. And when you're little like me, I was bullied. I didn't even have a heart defect, but I was bullied a lot when I was a kid. And I
Have
had
they
a
looked
hard time climbing the rope in PE. I could never get up there and ring that bell. I never rang the bell. There were a lot of things I couldn't do too. Yeah, I get it.
PE was not my strong suit anyway, but,
Yeah. I went
um,
into the band, so I didn't have to be in PE in high school.
then you could be bullied for being a band nerd, right?
Oh, yeah. It's funny. I was chuckling when Megan said that she was bullied for other reasons because I thought, yeah, me too, because I was a nerd and I was the president of the French club. They had lots of opportunities to bully me for all kinds of things. Well, let's go on
Yeah.
to the next one. So the next one was Megan Tones's essay, Picasso. I love the name of her essay because you would think it's about art, but no, it's about her living with scoliosis and how her mother found a way to help her feel better about her body. So I'm wondering if any of you have ever dealt with body image issues and how you dealt with that situation. Because Megan, I thought you did a beautiful job with that essay, and I'd love to know how other people handled that. Jason?
Yep, definitely have body issues. Yeah, you go to swimming pools and you have these scars down your chest and everyone's staring at you and purple lips. It definitely, you don't walk away from that and not have some type of issues. And it was interesting when I read, Megan, that you had developed scoliosis because I actually developed scoliosis later in life. And I never realized that I had actually gotten injured. I don't recall if it was on the job or what, but they went and did a back x-ray and they're like, oh yeah, you have 20% scoliosis. And I went, what? Like, that makes so much more sense why sometimes I walk hunched. And they said, yeah, it's actually very common for people that have had open heart surgeries because when they crack that chest open and they put it back together, it doesn't heal the way that it was originally made. And so that's generally what creates the scoliosis. And it was just incredible to read your story about that. I think for me, because obviously the severity of it is different than mine. I never had to have a back brace or anything like that. But then I also wasn't diagnosed with it until much later in life. And it was so strange for me. And it's amazing as you grow up with CHD and all of a sudden you're finding out that little things are connected to that CHD. So the scoliosis is connected to it. In my case, I developed Fontan associated liver disease, or because of my heart condition, I developed my liver cancer. So as you grow up and you see all these things that stack up, it's, oh my gosh, it's so true. Everything is all in a circle and it all relates to each other. So I found it very interesting just to read your scoliosis and how it really affected you.
Thanks.
Yeah.
It's interesting what you said, Jason, about the heart surgery, because I don't think it's just the sternotomy and the healing. When you watch open heart surgery, which I get to do doing anesthesia, people always talk about how you split the ribs and you spread the chest. That's true, but that also means when you spread the chest 8 or 9 inches wide like that, for about 2 hours, the bones in the back where the ribs intersect the spine, where they're attached to the spine, are horrendously, unnaturally torqued. And I'm not surprised that can cause an injury, and the healing from that might cause scoliosis later on.
Mm.
Makes
Yeah.
sense.
Yeah. It's very fascinating.
Yeah, and I think another thing too is that a lot of the surgeries for babies, like a pulmonary artery banding, for example, they go under the arm
Yes, which I
on
had.
the right side, which I had that one too. And I think when they put everything back together, they probably pinch a bit in here and pull you like this way. And then you can develop scoliosis a bit that way too, because most of the curvatures go that way in the thoracic region anyway. But I think that getting pulled this way and then growing like that, that can accentuate it a bit as well.
The original scar is this big when they do it. And of course, as our bodies grow, that scar grows bigger and bigger. And it's funny because I've got that scar and it literally goes from almost under my armpit to halfway around my back. And people look at
Mm.
that now and they're like, whoa, that's incredible. Yeah, but you don't realize that was originally only this big, but I grew and it grew with me.
Yeah.
Yeah, it's amazing all the stuff that really comes out of just what everyone thinks, oh, you just have a heart condition. Oh, no, so
Yeah,
much more
no.
than that.
That's right. The other thing is developing a heart condition as you're growing in the womb, that impacts your brain as well. You've got those circulatory problems throughout your whole development virtually and impacts the development of your brain as well. In my family, we have a lot of people diagnosed with ADHD and things like that as well. So there might be some genetic influence there, but apparently the parts of the brain that are responsible for social functioning, I don't know how to describe it, but more complex and higher order type things that they're not, I guess, for want of a better word, prioritized quite as much in development. Like all the essential sort of things happen, but maybe some parts don't develop quite as much as they should.
Plus, of course, the psychological of going through all these surgeries at such a
Yeah.
young age and being in and out of hospitals, in and out of doctors, and oh, I'm missing school because of this. I was actually amazed most recently as I'm starting to find out more from a lot of these CHDers, how many of them are actually very small in stature. I'm 6 foot and 190 some odd pounds. I'm a normal looking human for all intents and
Mm.
purposes. But I'm finding that a lot of CHDers are very short and usually very skinny. For me, it's strange because again, I look at myself and I'm normal. And again, it goes back to that congenital heart defect that creates all these other problems that people just don't realize. And I think that's what's
Mm.
so great about this book. As you read through it and you're reading the different stories and the different impacts that it's had on people. In your case, you wrote about the scoliosis, and Jenny wrote about the abuse that she got from other kids. And it's just incredible to see for me as I'm reading through this. Wow, this person's dealing with this. Oh, yeah, I guess I did deal with that. Wow, this person's dealing with it. Oh, yeah, I guess I did. But what each person individually finds as important in their being raised with CHDs.
Yeah, it's interesting what you say there, Jason, about people being short in stature and typically very skinny. I certainly noticed that in waiting rooms growing up, that there were some children and young adults there who actually looked quite a bit younger than their years. And in fact, I myself, I'm 5'4", so I'm not extremely short, but I am shorter than my parents. My hands and feet are actually quite big for my body, so I don't know if that means that I was meant to be taller, but I saw a heart failure nurse last week for an appointment and mentioned that I weighed, I'm sorry, I don't know how much this is in pounds, but never weighed more than about 53 kilos my whole life until I was in my mid 30s. And now all of a sudden I weigh 57. So the last 3 or 4 years, I feel like I've grown this way, which I guess is normal for that age group. But what they said to me was that was also around the time that you started new heart failure meds, being Entresto, spironolactone, I don't know if I said that, and Jardiance. And they said you might actually be getting more nutrition out of your food now. And this may be because your heart is working better, that you're in better condition physically. So that's a possibility as well.
It's a good thing, though. So isn't that
Oh,
nice?
yes. Yeah.
Yeah.
I'm
I
not
just
bothered. I just have to keep exercising.
There you go. Absolutely. I just realized I overlooked a question, and that was what everyone's biggest takeaway, or who would like to talk about their biggest takeaway from Laura Ryan's essay, which was It Takes a Child. And for those of you who read it, that was the essay that opened the book. And Sherry, I'd love to call on you, sweetie.
I'm going to make this a little short and sweet because my family said to come join me for dinner kind of stuff. So I'm sorry. I'll be better next week, I promise. But honestly, I think about it from the perspective of a grieving parent. So a lot of these things that I hear, it's like I know what you're going through, but I wish I was able to go through that with my son. And I'm not trying to belittle anybody's experience because what you're all going through and what you have gone through is trying in its own way. And I don't want to be insensitive to that because there's definitely a lot of pain and struggle involved. I just keep thinking as I hear you guys talk, oh, I wonder how my son would have gone through it. I wonder if he could have endured that, or would that have even been a problem? Would he be able to hike? So it's a little bit different for me. And I feel a little bad saying that because, like I said, I don't want to be insensitive to anybody here because I know that what you've experienced is a struggle for yourself, but you've overcome those struggles and it's great that you've been able to do that. And I just wish my son could have.
Sherry, if I may, the biggest thing
Mm,
that I've ever taken out of all of this is that
mm,
each of us, it's our own journey, it's our own story. And what is my story may not be or will not be, or maybe it will be someone else's story. And so
mhm.
that you have to make that acceptance and saying, hey, this is my son's story, flat out. And what they're capable of doing may or may not be what I am or am not capable of doing. You know what I mean? Like
Mm,
people prior to
yeah.
transplant might do, but
I
and
think what's
sometimes
hard is that
that's hard.
Thomas never got a chance to do any of that because he died in infancy.
Right.
So
Yeah.
there's a lot of wondering, and I can totally understand that, Sherry.
Mm,
But didn't you
mm.
think it was sweet how it was a little boy who helped Laura come to grips with her own scar? It was seeing that same center zipper on a little boy that made her realize, wait a minute, I'm not going to let this ruin my chance to enjoy the water slides. And she
Oh,
was
yeah.
able to
Mm.
move from being self conscious herself to wanting to make things better for this little boy who, just like her, had that zipper scar. And I just thought that was the sweetest essay. I'm so proud of Laura and all the work she did on that essay.
I think it shows that she is capable of looking beyond herself. And I think that's awesome.
Yeah, she just did
Mhm.
such a great job with that. I want us to get to the other three essays. The next one I'd like to talk about is Michael McKelvey's poem, where he talked about scars and tears and fears and the wish to be healthy. So we know that living with chronic illness is hard. What's one thing that you have found to be helpful when dealing with heavy issues, such as those described in Michael's poem? Is there someone who would like to address that?
I just need to say goodbye, Anna. I'm sorry.
Okay, that's fine. Enjoy your dinner, sweetie. We'll see you next week. Thanks for being
Thank
here
you.
tonight. We'll
Thanks for
talk more.
joining us, Sherry.
Yep, we'll talk more
Thanks
next week.
for having me. Yep. I'll see
Okay,
you next week.
bye.
Thank
Bye.
you. See you next time. Bye.
Yep.
Okay, so back to Michael McKelvey's poem. And he actually submitted that poem to a Mended Little Hearts contest. And it was featured on their website. And somebody said, oh my goodness, Anna, have you seen Michael's poem that really needs to be in the book? So I reached out to Michael and he said, sure, let's see if we can get it in the book. And Mended Little Hearts was really generous about letting us reprint his poem. So would anyone like to talk about that?
Yeah, I thought that was a really good poem that summed up what it was like to be particularly a younger person with CHD and realizing that it's just something that's not going to go away. And I think for me, it's recognizing and accepting there's going to be times when you're not feeling great about it, but there's always the possibility for things to change for the better in the future, and just trying to find things that you can enjoy. Some days that might be laying on the lounge watching a comedy or something that makes you feel good. Other times it might be going out and doing something with your family or a friend, or doing some art, or something like that. I think it's just trying to find things that bring you joy and happiness and meaning. It's not really so much about pushing the bad things away. It's like trying to have a balance.
Yeah. I liked how optimistic his poem was. Even though he was describing some really difficult things, I felt that he still found a way to be optimistic and upbeat. So I really loved his poem. Then we had another poem by Daja. Daja Scrivener wrote a poem called I Am Different. And it's funny because when I read her poem, I thought, wow, I bet every teenager feels that they are different. But her feeling different was very different than most kids because she had a heart attack at the age of 2, which I think most people maybe wouldn't even remember, but it seems as though that was a really traumatizing experience for her to the point where every year on the anniversary of that heart attack, she cries and she remembers that anniversary. So I felt that she was alluding to suffering from post traumatic stress disorder. And I'm wondering, is there a certain date or a certain event that makes you cry? Is there anyone who would like to talk about that?
For me, it's transplant. I had severe ICU delirium going through transplant, and yeah, I still have a lot of PTSD from it. Fortunately, now I've been able to control a lot of it. More so now that when I experience it, it's a recognizable thing where it's, oh boy, I just got taken back. And it's funny because I just recently went to my liver doctor and they said, oh, hey, you are back in, what is it, fatty liver disease. And I'm like, "Oh, okay. So I know that I need to change my diet. I need to get back on my diet that I was on and really start taking that a lot more serious because, yeah, it scared me. I'm like, I do not want to go through what I've been through before. So, yeah, there's definitely that's going to happen throughout your life. I've heard of people where it happens to them just in thinking about their surgeries, or even some that are like, hey, I'm getting ready to go in for it may be a minor procedure, but it's enough for them to trigger for them to really become scared with it. So yeah, it happens to us for sure.
Yeah, I think it even happens to parents. And it amazes me that Frank is able to work in a hospital because just walking into some hospitals, if they use the same kind of disinfectant that was used at University Hospital, just that smell, I feel this weight on my chest and it can bring tears to my eyes, just that smell alone. So I think that even the parents suffer from PTSD. I can't even imagine, Eileen, what you went through having not one, but two children undergoing surgery, one to help save the other from being on dialysis for the rest of her life.
Yeah.
Did you suffer PTSD from that?
I think before the heart transplant, I was literally having panic attacks. I would wake up crying. I would be at the store and they'd be off down some aisle checking junk food out. And I'd just all of a sudden just have this like panicky feeling like, how am I going to get through this? And how are we going to get her through it? I think what changed for Jessica was after Amy donated the kidney, that was a hard day. Having both of them in surgery, one after the other, was really hard. I don't think about it a whole lot anymore, but every once in a while, something brings it up. And we had other trauma around that. We had problems with insurance and doctors and whatever. So we had a lot of other added problems to deal with besides just the kidney transplant.
Like that
Um,
wasn't enough to deal with. And you had a heart transplant sometime before that. So you've had some
yeah,
major issues, just like Jason, going through
yeah,
multiple organ transplants.
yeah. And going back to one of the previous questions, as far as scars, her scars were pretty flat. They did really a good job, but the surgery before her transplant, they took off the bandage and it was like a big red angry worm down her chest, and she screamed and cried for 3 days because she was like 12 or 13 at the time, and she was just like a basket case from this. So I think after the transplant, they smoothed it out, and she'll wear scoop necks and stuff, and it doesn't bother her, but that was very traumatic for a long time,
That makes
and there was
sense.
nothing I could do.
I know, and it's so hard for a mother. You just want to protect your child and you just want to let
Yeah.
them know everything's going to be okay. But sometimes those scars don't look real great. And in fact, I've had other friends, mothers of daughters, who have had open heart surgery where the scar is so bad that they end up having to have plastic
Yeah.
surgery to repair it. And
Yeah.
they don't want to do another surgery that's not necessary. And yet, the mental health of our patients, of our children, is important too. And having them hate their body, that's a really rough thing to live with.
Well, and that comes with being a girl.
Absolutely.
You're born with
Absolutely.
hating your body. So,
Yeah. It's hard enough in America to be a girl and deal with that. But a lot of my friends whose children had problems, they called them robin breasted chests, the way that they healed. And so instead of a nice flat chest, it was like that. Or worse, the breasts would be off center. And for a girl, that's really a hard thing. Most girls are self conscious about their breasts anyway. Either they're too big, they're
Yeah.
too small.
Yeah.
You know, most women are not happy with their breasts no matter what. But then to not even have them be symmetrical or level, that just
Oh, that
makes
was a
it
huge
so much
problem.
worse.
Jessica had one side that was way bigger than the others. She ended up having breast reduction surgery because it was making her miserable. And we thought it might be contributing to backaches and headaches.
And that makes complete
Mm,
sense. Well,
Yeah.
we have one more essay, and I know you're going to want to weigh in on this one, Eileen, because the last essay in chapter 1 was by Tyler Sajak, and it was called Voiceless. And he, like so many heart warriors or patients with congenital heart disease, I know some people don't like heart warrior, had vocal cord damage. Now, our heart warrior, Frank's and mine, had vocal cord paralysis, had a partially paralyzed diaphragm. We were told our baby may never speak again, but that we should be lucky that the baby was alive. And as a person with a speech pathology background, I was a little freaked out because I thought, wait a minute, communication is really important and being able to speak, especially when you have a baby who's saying mama, bye bye, dada, and they come out completely aphonic. So, my question is, have you ever felt that there was a time when you were voiceless or when you couldn't find your voice or the words to describe how you felt?
Yep. Happened to me in transplant. So my fiance, wife now, but fiance at the time, they came in and told her, look, we have to trach him. And we had never discussed it. And as someone that worked in radio, and I'm a talker, if you can't tell, as I've been answering every question. Yeah, my voice means a ton to me. And when they trached me, yeah, I couldn't talk. But on top of that, because I was so swollen, I couldn't write. I couldn't lift my hands. Like I couldn't even take an iPad and push a button because I couldn't see. I had no way to communicate. And I literally had to just lay there and take whatever came my way. So it's challenging. When I read his story, I was just in awe. First of all, again, I was fortunate enough to meet with Tyler out in Chicago. And what an amazing gentleman he is. To hear him now, like you would never know that he went through that. That's why I think I was so surprised when I read that story. I was just like, whoa, you've got to be kidding me. And again, it goes back to here it is. He had a voice problem because of his heart condition. So again, there's so many things that come out of just a heart condition, if you will, that people are like, they're amazed. And I think that's why this book is so awesome for people that don't know much about heart conditions, let alone about people that have heart conditions, because a lot of us will say this growing up. We didn't know anyone else that had a heart condition. I didn't meet my first heart friend until I was 40 years old. That makes a huge difference there to read about all these different issues that concern you, whether it's voiceless or being bullied or just the insecurity or the scoliosis. It's so amazing because again, I look back on my own life and I'm like, wow, okay, I didn't have the voiceless part, at least not until transplant. Yeah, I had the scoliosis. Oh my gosh, we are similar. This is so weird. Like this book was so amazing. And I think if enough people get a chance to read this, especially for parents who just found out that their child has a CHD, this is going to make such a huge difference in their psychology of how they're going to raise their children, knowing as they read through these, oh, okay, this is normal for them and this is normal for them. Think more so because they're hearing it from actual patients as opposed to maybe from a doctor or reading it online. It makes so much more of a difference when it's coming from actual patients.
I would agree with that. I think one of the things that I wish I would have had this book 20 some odd years ago for is just to be prepared. Because, like you said, Jason, I didn't know as many people as I do now for sure. Before the internet, I only knew a couple of people. I actually knew 3 other women who had children with a congenital heart defect, and they all had HLHS because we were all in the hospital at the same time. And I knew that one of those babies was getting a heart transplant. So I knew there was that potential. But I didn't know if anybody else had a kid with voice problem like what my kid until years later. And there are so many other conditions that we don't have in this book that I hope we'll cover in future books like classic bronchitis and PLE. I don't want parents to be terrified when they read this book. What I want them to see is that, yes, there are some problems that people can have, but look at how resilient these people are, and look at how they've been able to overcome even when they do have a problem. So, thanks for sharing about that. I hadn't even thought about being trached. I know that's an issue. Frank and I have a friend who had a stroke and she had to be trached. And I remember her telling me later how traumatizing that was for her because she couldn't communicate.
Yeah.
So,
Yep. It's a challenge. It's a challenge. And when you don't discuss it, we discussed every other possibility except for that, because I was just so confident going into my transplant. It wasn't even a thought in my head that was going to happen. And honestly, it didn't even happen until almost 2 weeks after my transplant because of just things that happened. So yeah, it's incredible.
Eileen?
So, being a speech therapist, I was mostly in special ed. And I think it was the summer before Jessica's transplant. I was doing summer school and all the kids were in the wading pool. I could not believe how many had zippers. Plus, they had other problems because they were all in special ed. There's that. Jessica never had a problem with her voice. There are so many things running through my head right now. Jessica was born 41 years ago almost. We didn't know anything. I mean, I knew special ed stuff, but I didn't know about heart stuff. And that was a really big learning experience. And nothing was ever recommended about seeing a therapist or getting on an antidepressant. I was crying all the time and I didn't know what to do with all of it. So over the years, I've learned you need to talk to people. When the internet became available, what a game changer that was. It could have its negative side, but I didn't have this when she was a baby. And that would have been really helpful to have other people to talk to. I was hoping when Jessica wrote her book that it would reach people. And I think I started to say this before. When Amy gave Jessica the kidney, it made Jessica want to reach out and help more people. She never wanted to talk about it before that, but she wanted to reach out and help more people. And that's what she has done over the years. And I think she really likes it. She was in the Go Red campaign for the American Heart Association. She's done a lot of things. And I think it is important, like Jason said, that people read things like this because, again, this is an invisible problem for the most part. And then all the other things that go along with it can be invisible, like losing your voice. You don't know until the person opens their mouth and nothing comes out, but there are more things you can do to communicate. But if people don't know about it, it's like, how do you get that word out there?
I never practiced as a speech pathologist. I practiced as a speech pathologist student. So I did over 300 clinical hours of speech therapy, mostly in a clinical setting, but also at the Texas School for the Deaf because I was a teacher of the deaf and hard of hearing. And his essay just resonated so much with me from having a child who had difficulty being heard, was completely aphonic for over a year. I tried to teach sign language. She didn't want to learn sign language. She was resistant to that because she wanted to speak just like her brother, and she didn't understand why ma didn't mean 5 different things. And the sign language actually did help open her mind to realizing that ma can stand for mom. When the different putting the sign with it helped her to realize that. And finally, it's like she found her voice all over again. But I found it fascinating that they were able to take a nerve from a different part of his body and put that on his vocal cord because the only other vocal cord surgery I had heard about was with Michael Pernick. When I met him in person at an ACHA event, he told me he had vocal cord paralysis and they put like a block in his throat to push the vocal cord out so it would be closer to the one that did vibrate. And so I had heard of that procedure, and even that seemed really unusual to me. But this one, where they take a nerve and that it worked the next day, that there was
Wow.
no huge recovery period, but he opened his mouth, and for the first time, everybody could hear him very
Wow.
clearly. I was just blown away. I have to confess, I had tears in my eyes because I just know how important it is to be able to be heard. Megan?
No, I was going to say it was quite amazing, wasn't it? That he found out about that surgery almost by chance, and it gave him an opportunity to speak to his grandparents. And I recall even reading the excerpts from Jessica's book, reading all of the stuff that she was going through and thinking, oh my gosh, like, how would you ever figure this out? A lot of the symptoms she had were so non-specific in a sense. And I think it was just by chance, I think, wasn't it, that you were talking to a neighbor or a friend or something, and they mentioned something and the light bulb went off, and then
Yeah.
the
Who would
problem
expect
was
dad's
figured
football
out.
Yeah, who would expect
Well,
dad's
I
football injury to result in his son having finally an operation that would allow him to have a voice? I just
Mm,
found that amazing.
it's, yeah, quite remarkable the way these things can work out
Mhm.
sometimes.
Jessica had trouble with her gallbladder. So there was another mystery to the doctors, which they
Mm.
don't really appreciate a speech therapist diagnosing gallbladder problems. But I was convinced it was her gallbladder, and I was right.
We'll be talking about that more in volume 3. When I read her book, I really hoped that she would let me make that available to my readers as well. And I'm hoping that through the sale of The Heart of a Heart Warrior, more people will say, wait a minute, I need Jessica Carmel's book as well, because
I
it's really
did she say
important.
you couldn't do that?
No, she
Because
did. She let us put excerpts from the book.
no, I know, but okay. So they'll see it that way. Yeah.
So they'll be able to see the excerpts, and I'm hoping that when they see the excerpts that we chose, which one of them was about the gallbladder, that will make the reader say, "Oh, there's a whole book about Jessica. I want to read that." So we actually have a couple of excerpts from some of the other authors. I'm so impressed with the CHD community, and I'm hoping to add John's
Awesome.
name to that list soon. I know he's starting to work on his memoir. And there is so much information that we can glean from one another. I want to thank all of you for participating. You helped to bring the book alive. And that's what I was hoping we could do with the book study is we could look at all of these different essays, say how they affected us, what memories they brought up, or what advice you would have for those conditions or those situations. And that's what we'll be doing next week. So next week, we'll be looking at chapter 2, which is how my heart defect defines me. Jason, you have to show up because we'll be going over your essay. And then
Great. Yeah.
we'll also be talking about the first 2 essays of chapter 3. And the reason why Megan and I did this is because we would like to have all of the book discussed within the first 3 sessions. So the 4th session can be a Jeopardy game, and we're going to have a lot of fun with that. I'll be giving out some door prizes, and hopefully everyone will walk away feeling happy and uplifted. Megan?
Thank you to everybody for coming along, and hope you enjoyed the session today. I hope you're enjoying the book. And I think for me as an author, it's been wonderful to hear all this positive feedback from people. And I know myself from talking to people in the community for parents of younger children and adults that they see so much value in being able to see and talk with older people with CHD and learn about what they've been through. It gives them hope for their own children. I know for my own mother, when I was a baby, she didn't know anybody with CHD, but my aunt was a special ed teacher, and she managed to put my mom in touch with the parent of an older boy with CHD. And I know that mum found that really helpful to be able to talk with that boy's mother. Of course, with the internet, that type of thing's a lot easier, but I think that the book's a great idea. Someone can just sit and read it or listen to it at any time. Yeah,
Yeah,
I
I
hope
hope
you'll join us
everybody
next week.
Yeah, and I hope everybody enjoys listening to Megan and me and give us some feedback because we're giving it away for free right now. We want everybody to have a chance to hear these wonderful stories. But my hope is to eventually make an audiobook.
Audio.
And I would like to know how you like having the two different voices, if it's distracting or if it's nice to have the variation in the reading, especially since we're making a point of Megan reading what she wrote as far as introductions to chapters and her own essays. I think it's lovely to be able to hear people's essays in that person's voice with that person's accent. And I'm not trying to do accents for all the other people. You just get a Texan accent with me. That's it. But Megan and I are really having a good time putting the book together, and it definitely is a labor of love. It is going out on Heart to Heart with Anna. If you haven't heard it, tomorrow will be chapter 2, and the first 2 essays of chapter 3 will be a week ahead of what we're discussing the next week. So if you don't have a chance to read it, but you're planning a long trip or you take long showers and you can listen to a podcast while you're in the shower, then you get a chance to read the book by hearing it from Megan and me. So I hope you all have a great week. And I hope you will come back next week, especially you, Jason.
I'll be here.
I'm really hoping that Hope is not working next week. She's working tonight, so that's why she couldn't make it.
Okay.
But I'd love for her to be there. And I'm going to reach out to Christy as well because it would be really awesome for the three of you
And
to.
we'll see if we can get
Oh,
Jessica.
yeah.
Yeah, we're trying to twist Jessica's arm too.
Yeah, hopefully she
Um,
can.
For all
Yeah.
of you, if any of you, since none of you, and I'm included in this, have written a review of the book, if you wouldn't mind going to Amazon and write a review. We only have 3 reviews right now. And a lot of times people will not buy a book unless there are tons of reviews. So I'm hoping you like the book and you want to give us a good rating and that you can share why you found this book valuable. In case you're feeling a little self conscious about that, Jason, Megan, Tracy Salgado, and Lisa Colville already went. They're 2 of the 3 people who have written a review, and they did identify that they were contributors to the book. And I don't see a problem with that. I plan on going out and identifying myself as one of the editors. Of course, I'm going to be biased. And I don't know if that will make Amazon decide not to include mine since I'm the editor and a publisher. We'll see what happens with that. But just give an honest review, and that will help other people to see the book. Amazon has this algorithm where the more reviews you get and the more the book is referred and the higher it shows up in searches. So if somebody types in CHD, I don't know where our book shows up right now, or if they type in congenital heart defect, I'm not sure where our book would show. But the more reviews we get, especially if we get more current reviews, the higher it will be. And hopefully the more people we can help with the book.
I'll post something on Facebook too.
Oh, that would be awesome. Thank
Yeah.
you. And yeah, and if y'all wouldn't mind saying whether or not you enjoyed this book study, if you plan on coming back next week, I've decided that because it seems like so many things came up today where people wanted to come and they weren't able to, that's why I'm recording it. But I'm going to allow people to come to any of the sessions. That way, if they have to miss 1 or 2, it won't be a big deal. That way, we'll get to hear some more voices. So I hope
Sounds
everybody
good.
has a great week. Thanks. And any way you can help, I appreciate it. See you all
Thank you,
next
Anna.
week.
Bye-bye.
Bye.
Bye.
Bye. Thanks,
Bye.
Megan.